Good afternoon, and welcome to a presentation of updating practice strategies with high-frequency pulse vibration. My name is Dr. Gary Brigham, and I'll be hosting this afternoon's presentation. Now, my experience with pulse vibration began back in 2014, and since then, as a solo practitioner, I've treated over 612 patients, including just over 280 teens and pre-teen patients using high-frequency vibration with the clear aligners. I've had the opportunity to participate in beta testing projects for Propel's products and currently serve on the clinical advisory board for Propel and the aligned faculty, as well as I serve as an adjunct professor of orthodontics at the A.T. Still Orthodontic program in Mesa, Arizona. In addition, I also serve as a mentor for Your Ortho Coach. I'd like to begin by stating that the statements, the views, and the opinions that are going to be expressed in this presentation are solely my own. And that they're based on my background, my experience, education, and they're not endorsed by Propel Orthodontics. And just to get this out of the way, as a disclosure, I'm not employed by any orthodontic or dental company. I don't own any stock. I don't have any family members employed by any of these companies. And as I've said before, I've consulted and evaluated products for some dental organizations and orthodontic organizations, including Propel and Align Technology. And then the other thing I'd like to emphasize, in spite of the fact that I've been compensated in the past for consulting or presenting these webinars, I am not a paid consultant, nor have I ever been for any orthodontic company or any orthodontic product. Okay, now that that's out of the way, I'd like to start again with a true story. And here this woman came in, she's 73 years old, and she's been with the same dentist for the past 15 years. And he's been summarily changing out all these posterior teeth with crowns and whatever it takes. But you can see she's nicely crowned, but she has no function whatsoever. And she kept on asking, what can I do? And he actually said, I think you're a little too old to be doing anything like that, all right? Until one day she just took a look at herself and said, I'm just going to go see an orthodontist. So she walked into my office, and the problem with complete absence of incisal and canine guidance is there's consequences, and those consequences have been delineated in research over the past decade. And the problem is loss of protection of the posterior teeth from excessive forces and from protrusive and lateral stresses during function create clinical consequences. And those clinical consequences I see every day in my office. And these patients come in, they're usually missing one or two posterior teeth. Oftentimes there's endodontically treated posterior teeth. This is no surprise to me. There's always crowns to multiple posterior teeth, and that's exactly what I see right here. Oftentimes it's accompanied by vertical bone loss and compromised periodontal support from multiple posterior teeth. And a lot of times they come along with symptoms of TMJ. And a lot of times there's a combination platter for all this. And that's what this woman has. She's been grinding away just because she has no incisal guidance and no lateral excursions, no protection. She's just been banging away at her back teeth. And she just listens to the dentist. Well, it's time for another crown. Okay. So the plan that we had for her is Invisalign Comprehensive. We wanted to address her concerns, and her concerns were, the crooked anterior teeth. So we wanted to establish that. For function, I wanted to establish some type of incisal guidance with a physiological interincisal angle. Wanted to give her some type of acceptable overjet and overbite. And more importantly, we wanted to change the smile aesthetics, because right now there aren't any for this smile. And after 74 aligners on a 5 to 7 day aligner exchange with a V-Pro Plus, she was able to finish in 13 months and 3 weeks. Now, originally she was a MOPS candidate until she went home and looked it up and saw that same old video that I referenced previously about with Metallica music. So it scared her. So she came back and says, I can't do that. She said, but can I use the V-Pro? And she said, I promise I'll be good. And can I still flip them out every 3 days? And I said, no. But if you're very good about wearing them 22 hours a day, you can flip them out every 5 days. And I never tell them 5 days. It's always a range. So I said 5 to 7 days. And she makes the decision based on tracking. So we have to make sure that she understands good tracking. And she did. She was highly compliant, changed the entire veneer of her teeth, and then she ended up bringing in her poker club. I love when women play poker, because once they get seen, they bring in their friends. So previously I've explained why I've incorporated acceleration in my practice. And now I'm going to say I think it's really become a critical necessity in my practice. And the reason why is even over the past year, patient expectations for length of treatment are becoming increasingly unrealistic, at least for me. I find that patient cooperation with treatment is diminishing significantly over time. Patients understanding that treatment success is based on a partnership between the doctor and the patient is becoming essentially non-existent. I really feel that patients are starting to look at an orthodontic practice like an auto body shop where they just drop themselves off and get fixed and then leave, and that's not the way orthodontics works. And most importantly, patient expectations for exceptional results have remained high, and in many instances, they're becoming increasingly unrealistic. I get these patients that say, well, when I look from the side, I see this one tooth. You know, I think patients are becoming really fixated, not everyone, of course, but a lot of them fixated on their teeth, and they have this high demand, yet they're not willing to put in the work. So I think that by embracing acceleration, it's really helped get me through some of these patients and have a more realistic outcome with real and measuring those realistic expectations. So what I want to cover today is the complex history of pulse vibration. I want to go over the science supporting high frequency vibration. We'll go over the device. We'll talk, show you some cases from preteen all the way to adult. I also want to address the synergistic effect of MOPS and high frequency vibration because I use that a lot. I want to go over high frequency vibration and its use in retention, and also how it improves alveolar bone density for extractions and also for implants. So let's begin. So the literature, all in the past decade and a half, has had a lot of literature, as you can see by the dates, all right? And there's a whole body of literature that was claiming acceleration of orthodontic tooth movement with pulse vibration. And all these studies claim to have or demonstrate substantive positive results with, with orthodontic tooth movement. And more importantly, all these acceleration claims were made by researchers of both low frequency and high frequency studies. But on the other hand, there was a whole body of literature more recently, of course, that claimed no acceleration of orthodontic tooth movement with any type of pulse vibration development. And all these studies claim no significant results. And more importantly, the failure to accelerate claims made by researchers of both low frequency and high frequency studies. So it was almost evenly based on all this research. And the bottom line is this: why the confusion and controversy with regarding this and all this disagreement? Well, when according to grade, and there's a great paper that explains this, but this is really the yardstick by which all research is measured with regard to the quality and the efficacy and how these research programs were conducted. And so the quality of all the aforementioned research evaluating the efficacy of vibration orthodontic tooth movement was assessed by grade as extremely low. In other words, what they were saying is it was not valid at all. So, and why? Because a lot of these studies had significant methodological flaws. So for example, laying claims to some type of response for pulse vibration when they didn't have a sham device and they were just doing controls of patients. And we know that that has nothing to do with having a valid type of study or drawing any conclusions from it. And then also there were varying vibrational stimuli among the studies. There was no consensus whatsoever. Some were testing 10 megahertz, some 50, some 30, some 75. It was just really a hodgepodge. And there was no way to conduct any type of studies that you can actually compare the data to because of the different megahertz. And then there was varying tooth movement that sometimes they were comparing incisors movements, sometimes they're comparing canine, sometimes bicuspid. And then they were, on top of that, they're studying different modalities of orthodontic tooth movement, aligners versus fixed appliances. So again, it was very difficult to draw any logical, rational, and more importantly, significant conclusions with regard to pulse vibration. All right, so if you were confused during this period of time about pulse vibration, orthodontic tooth movement, you had every reason to be until now. And I really think that 2018 I regard as a turning point for high frequency vibration because there was a plethora of studies. And they all investigated bone quality and showed that it improved. Extraction healing was improved. There was one study on astronauts and showed that high frequency was most important for bone density. Accelerated tooth movement, they showed head-to-head mechanical and biological aspects of it. Refinements were reduced. Some studies showed the root resorption was reduced, pain was reduced, accuracy was improved, the patients recovered better from osteoporosis, and also the improved retention density and recapture. And this was the trial landmark. I think Alakani, I honestly believe he took it personally because it was one of his papers that was considered low grade and back in 2016. So he went back to the drawing board, and this was incredible. He took every single parameter and he did it at every single point so he could compare all the way down the line. And if you haven't read it, I would strongly suggest that you do because it'll help clarify any doubts that you have about high frequency vibration. But what he found was high frequency vibration in the presence of orthodontic forces is catabolic and accelerates orthodontic tooth movement. And when you eliminate, orthodontic tooth forces, in the absence of those forces, high frequency vibration is strongly anabolic and increases not only bone mineralization, but also bone density. So, and then what we found that Horgom and his research group found that, again, high frequency vibration not only accelerated orthodontic tooth movement, but also decreased bone mineral density, which you need in order to get some type of acceleration. And they also showed that increased expression of TNF, which is just simply a cytokine that's been always associated with reduced bone density and orthodontic tooth movement. And also they showed apoptosis of compressed PDL cells, and that's where the action is when you're trying to get the biology to turn over faster, which actually affects the acceleration of orthodontic tooth movement. So all this research, as you can see, this is very recent, back in 2020, but it's all starting to coming together. And obviously, you have to be careful about when a speaker is talking about his own research, but actually this wasn't really published in a peer-reviewed journal. But I simply joined it because we really wanted to see if patients would actually notice some type of reduction in discomfort when we use the high frequency vibration device. And I was pleasantly surprised and sometimes even taken back at the high number of patients came in and said they noticed a difference when they used high frequency vibration and on the days that they didn't. And we found that I actually got a very good compliance rate, but that could have been for the fact that they knew that they were part of a study and that they had to constantly fill out these forms and they were basically diaries so that we can determine if they actually did have some resolution of some of the discomfort that's associated with orthodontic tooth movement. So in essence, we found that there was meaningful extended orthodontic pain relief in all 4 sites, in other words, all 4 offices. But more importantly, then there was actually a well-done study by Al-Ansari with high frequency vibration, and he demonstrated statistically significant reduction in pain and discomfort when compared to all treatment and control groups. And also he found better aligner tracting with 5-day exchange than versus 7 days with no vibration whatsoever. And you can see the percentages. It's very important. And more importantly, found that you got just as much tracking with 5 days on the vPro than he did with 14 days as a control with no vPro whatsoever. So the same amount of tracking. And when you add vPro on a 7-day tracking, it's even better. And as I found in my own practice, when I've attempted to test this by exchanging aligners every 5 days without any type of frequency vibration, I found that I'd have to discontinue it because these patients would be untracking it within the first 5 to 7 aligners. So I long ago abandoned that, knowing that it just wasn't feasible. So what do we know on frequency of vibration and accelerated orthodontic tooth movement bone density? Statistically significant accelerated aligner exchange rate and corresponding tooth movements. We also Shipley found that significantly improved bone density from pre-treatment levels when used during the retention phase. And he used CBCT analysis, and although this is a little blurry, I'd encourage you to read that paper too, because it's significant and you can definitely see a difference in the bone density. Also, with regard to why 120 megahertz? Why not 30? Why not 50? Well, there's some very cogent reasons why. First of all, safety. It's been shown that the amplification of the stress level to the PDL induced by vibration needs to be below 300 to 800 megahertz. Now, this is obviously extravagant, but this was the range where you start seeing some damage to the bone, and obviously this is well within the range. All right. And as far as efficiency, you need to understand that the amplitude of force and frequency can be considerably lower than the motor vibrating frequency, which is often mistakenly labeled as the tooth vibrating frequency. It's the same thing as a car. You get a car and it says 450 horsepower, but that's not the horsepower that's being delivered to the crankshaft. It actually is mitigated down significantly. And the reality is, with the V-Pro, it's been shown to be safe to tooth structure and supporting alveolar bone elements, possibly because it's not even getting the 120 megahertz. And I'll explain that very shortly. The bottom line is there's an energy loss with the vibration devices, and it's due to a number of factors. And just like with the car analogy that I used, and one of those factors is damping, friction, insufficient contact between the tooth and the vibrating medium. And research has also indicated that over 50 megahertz is required. That's required to accelerate orthodontic tooth movement. And it's also been shown that the differential between motor frequency and tooth vibrating frequency can be almost as much as half. So the 120 megahertz is well within that range for getting accelerated tooth movement. So even if the damping effect brought it down to 70 or even 60, you're still well within that framework to get accelerated tooth movement. But this could possibly explain why 30 megahertz vibration devices cannot possibly accelerate orthodontic tooth movement, because this is the motor vibrating frequency. And if you cut that in half or even damp that down to 15 or 20 megahertz, you have nothing. You'll have an anabolic effect, a light anabolic effect, but there's no possible way that you can have any type of acceleration with that level of frequency. And then research indicates the failure. And since that understanding has come about, there's been more than a couple research papers, and you can see it's relative. 2018 with Sandra Tyner group, and also in 2019, they found that there was absolutely no accelerated tooth movement at 30 megahertz whatsoever. So I don't blame Kevin O'Brien for having these cute little blogs that said, this one was orthodontic vibration is the air guitar. I don't see the analogy there, but still, what he was trying to say is there was no evidence that frequency vibration had any effect on orthodontic tooth movement. However, just like he made an error in trying to compare the efficacy of MOPS by not understanding the difference between using a TAD and the Propel's proprietary stainless steel tip, which I clearly delineated in my previous MOPS webinar. I think Kevin has not made the distinguishing mark between 120 hertz and 30 hertz, probably because he doesn't really understand. So in this particular case, I think he shows that he's really referencing 30 megahertz. And for that, I'm in total agreement. So I hope we're clear on this. If confusion remains regarding the efficacy of high frequency vibration, it may be because current pundits and even KOLs continue to fail to distinguish between low and high frequency vibration. And even today, there remains a lack of appreciation and understanding of the science behind this. And skepticism remains based upon the previous experience with low frequency vibration devices and their subsequent failure to meet the marketing claims. So again, I think Kevin O'Brien just came out with something last month, and just saying, I think it was his vibration device is dead. And once again, he's still looking at only low frequency. And if he's looking at that, then I agree with him 100%. But to make that all-encompassing statement is just misleading, it's misinterpreted, and it's just basically wrong. So let's talk about the science supporting the effects, all right? You've seen this before. What we definitely know is the rate limiting factor for orthodontic tooth movement is bone resorption at the bone and PDL interface, okay? And that's right here. This is where all the action occurs. And that bone remodeling also affects the rate of orthodontic tooth movement. That's That's de rigueur. That's been known. And once again, there's a whole host of cytokine blasts that occur around this area, and you can see I've got TNF down here as one of the chief ones. That's why it's important in these research papers to monitor that, to show that there's an elevated level of TNF, as well as others like IL-1-A. Okay. And that the inflammatory response in orthodontic tooth movement is associated with the production and release of a cascade of cytokines. That's de rigueur. It has to be shown. And these cytokines stimulate not only osteoclastic formation and function, but also impacts the rate of bone remodeling and subsequently has an impact on orthodontic tooth movement. And this continues to be researched. So it's important to understand it's bone remodeling and cytokine expression. And when you're using pulse vibration, it doesn't disrupt the membrane of these osteocytes, but it irritates them enough, and the stimulus is enough for them to cause them to secrete cytokines. And the cytokine has been shown to generate osteoclastic activity, differentiation, and survival on a significant level. And these osteocytes, through elaborate chemical signaling abilities, which they're starting to get a little bit more handle on this, because now they find that it's not only at the membrane level, but also intracellularly. And they're critical for being involved in osteoclastogenesis. So now more research has shown that it's not just at the membrane level, but it's also in the intracellular level. And it seems to be generated from the nucleus of these cells. So Alakani's research has proved how high frequency vibration affects acceleration. It's an excellent article. And also, as a follow-up, Alan Sari's article has proved that high frequency vibration accelerates orthodontic tooth movement in humans. Very important. And despite the heightened scrutiny over low frequency vibrations devices failure, all right, the FDA has nevertheless reviewed the literature, the most recent literature, and cleared high frequency vibration devices for significantly faster orthodontic tooth movement. That, yeah, hopefully getting more understanding that low frequency vibration simply does not work, all right, but high frequency does. And I think the FDA scrutiny has actually delineated that and now agrees that high frequency vibration has been shown to accelerate orthodontic tooth movement. All right, so the target cells and mechanisms of action have been identified, and significant acceleration of tooth movement has been demonstrated and continues to be demonstrated in all this research. And you can see it's basically most recent from in the past few years. And it's good research, you know. So the mechanism of possible, the summary of possible mechanism of action are simply the catabolic effect of high frequency vibration is based upon the synergistic increased inflammatory response of the PDL undergoing continuous compressive force. That's critical. Without the compressive force, there is no catabolism, all right? And that the enhanced cytokine cascade that's generated by high frequency vibration results in the recruitment, differentiation, and increased proliferation of osteoclastic activity. So let's go over the device. I'm sure you're all very familiar with it. It's the vPro Plus. There's no vPro 5 anymore. And there's been some significant upgrades, not only with the wireless charging, but the most important thing is the patient mobile app. And there's no program expiration date. That's really makes it a standout. And the fact that it's got a replaceable mouthpiece means that one device can be used by multiple family members as long as they just get a new mouthpiece. And that's been true in my own practice, all right? Now, with this patient app, it's very patient friendly. It's very easy to download. It's simple, it's intuitive, and it helps patients stay on track with their treatment. More importantly, parents can also get involved. They can easily share these results via email. So it just helps. Now, are parents all over these kids? It's not necessary, because these kids, in fact, they're such good screenagers that they get really nicely involved with this. And it's just another thing that they can look at their screens with. So let's look at some cases. So we're going to start with preteen cases, because these are my favorites. All right. Here she is. She's 9 years old, comes in the press. She's got bimaxillary arch constriction. And I have to tell you, maybe 15 years ago, I would be thinking about a 4 bicuspid extraction case, just by virtue of the constriction, but not anymore. already these kids are very self-conscious about the crooked teeth, and that's what brought her in. She actually brought her mother in and dragged her in, basically, you know. So treatment plan was Invisalign first, upper and lower, designed to develop and coordinate the arches, create space with the hopes of not having to take out any permanent teeth, wanted to establish acceptable overjet and overbite, and give her the aesthetic smile that she was looking for. But we also highly recommended the V-Pro to enhance aligner tracking, to reduce the aligner discomfort, because a mother did express a concern about is she going to be able to handle this with the discomfort, how it would interfere with her school. And I said, I think we've got a resolution for that. And my experience with V-Pro, I was able to say with definitively that I think she'll do fine. And I'll hope to increase the aligner exchange rate with the V-Pro. And here she is finished, arch form nicely developed, got the aesthetic smile that she wants. She's got a beautiful smile arc, filled the buccal corridors. Treatment time, 4 months and 2 weeks. With the V-Pro, she's able to exchange the aligners twice a week. Now, I never tell them to do that. I say, let's try every 5 days, but if you find that it's getting floppy after 3 or 4 days, go ahead and exchange it. And these kids at this age, when they've got a V-Pro, they do very, very well. There was no need for any additional aligners. We met our treatment objectives. And I got to tell you, in all my years of practice, I never finished a phase 1 in 4 months and 2 weeks with fixed appliance therapy. And then what happens? You get the family to come in. So we get sibling number 1. So I decided to use the traditional Haas prior to Invisalign first, because it was I felt it was a true bony problem. So we've got her out of this. And now's the time to start the V-Pro, because now it'll help mineralize the suture there, so we can get her out of that Haas faster. And with her other sibling, we're going right into Invisalign first. So now we've got 1 motor and 3 kids are sharing it. We've got a 10-year-old, she came in class 1. She's been very concerned, very self-conscious about this Cumberland gap between her teeth, and you know, doesn't really have good overjet and overbite. She's got some maxillary spacing. She's got a skewered arch form. It's not well coordinated, but her principal concern is the gap between the teeth. So we're going to do the same thing in Invisalign first, throw in a V-Pro to enhance the same thing. Want to enhance the aligner tracking, reduce the discomfort, and increase the aligner exchange rate. And sure enough, we've met our objectives, made the patient happy. We addressed her principal concern, got plenty of good arch form to fit all the teeth in. I've already finished my overjet and overbite, so now this is going to be a walk in the park to phase 2. Finished in 9 months and 3 weeks, exchanging at 5 days. All right, and when I say 5 days, I tell them 5, 6, or 7 days, but she did very, very well with a total of 59 aligners, and the only adjunctive therapy was a V-Pro Plus. And teen cases, just as well. We've got a patient here, she's got actually a class 3 scala. You can see her profile. She's got a significant posterior crossbite, and she's almost 14 years old. I don't have too much growth to work with. Having a crossbite of long standing, she's got a mandibular shift to her left because her dental midline is already on, so that discrepancy is all due to the shift. She doesn't like her bite, and she feels she's got a crooked smile, and she doesn't want to be in treatment for long. So I said, well, I said, we can get you out of this, but you've got to use a V-Pro, and that'll allow you to flip them out every 5 days, but you got to wear them 22 hours a day. And she said, I'll do it. And it's very rare that they comply like that. And you know something, if I was thinking, which I wasn't at the time, and I had been using the V-Pro for a while, because my normal protocol was get the expansion and then hold the appliance for 4 months to allow the suture to fill in so that I didn't get any constriction. Now with the V-Pro, now what I do is that I don't have to wait 4 months anymore. I'm waiting 2 months. I have them use the V-Pro twice a day, 10 minutes a day, 5 in the morning, 5 at night. That allows me to dispense of this sooner without having suffered any collapsing of the arch. So that's been very significant. And so here she is finished after her Hyrex and after a bout with Align and using the V-Pro 5. Total treatment time in Invisalign, only 6 months. And yet, even before I start, she said, how long is this going to take? And I said, I'll let you know when we get started. You know, but she was good because she didn't want to be in treatment. We were able to actually exchange the aligners every 5 days. And that's pretty rare. It's usually 5, 6, or 7 days. So I was very pleased with that. There was no refinement in this case, and she did it all with the VPro Plus. Same thing here, class 1, she's almost 19 years old. She's had the crossbite. She's very disturbed by her smile and the darkness of the buccal corridors. So what she wants is, and she doesn't want to be in treatment long. So once again, the treatment is Invisalign Comprehensive. Recommend the VPro to enhance her tracking and hopefully to expedite the treatment. And there she is finished. Nice buccal corridors, a nice smile arc to follow the contour of the lower lip, good broadened arch form. And I'm not unhappy with this patient, nor am I unhappy with how long it took. 11 months and 3 weeks. These cases used to take me 16, 17, 18 months, sometimes even longer. But with a 5 to 7 day aligner exchange and 54 aligners, we were able to finish in under a year. Same thing, she was a phase 1 candidate, and I'll tell you, 15 years ago, again, I'd take a look at this, and without even looking at the records, I'd be thinking 4 by extraction, just by looking at where the permanent first molar was here and where this lateral incisor was, and midline's way off, but not anymore because of Invisalign and because of acceleration. Because now I'm thinking that I put her through a traditional phase 1 because we didn't have Invisalign first at the time. So here she is finished with Invisalign, with her phase 1. And so I follow them, and just before I'm ready to do Invisalign, if I don't have enough room for the canine, in order to reduce the number of liners, I'll throw in a DMAX for a couple months, get this going. And so what I'll do is I'll freeze these springs, take the appliance out, scan the patient, take the ALM off, leave this in, and then cement the appliance back in because that's my retainer. But now I've got frozen springs. And so when the aligners come in, we take this out, get rid of this, and go to town. So that's what we wanted. She wanted phase 2 Invisalign. She didn't want to see braces again, so we did. That was the treatment plan. But we also wanted to. She'd been in treatment for a while, so she wanted to get through this as expeditiously as possible. And I felt that perhaps the vibration would help bring the canines down because they were still up there. And I was very pleased to find that those canines came in very rapidly once we started Invisalign. And I really do think it had a lot to do with applying the VPro 5 minutes in the morning, 5 minutes at night. Total treatment time, 12 months. Not unhappy with that treatment time. And especially with the number of aligners. She had her first round of 25, and then when the canines popped in, we stopped early on the first round and went right into the second round so we could finish her off. In adult cases, same thing. It's more complicated because the bone's more dense. Now, originally, we had signed her up for MOPS, but once again, she saw that webinar or that video, scared the heck out of her. So she said, I'm not going to do that. She said, do you have anything else? And I said, well, we'll do the VPro. And so she said, I promise I'll be good. And so once again, we did the VPro. We hoped it would enhance her aligner tracking and hopefully get some type of expedited treatment. And I'm not unhappy with the results. Got that nice filled buccal corridor, a good smile arc, got the arch form that we try to impart in every patient. And she did swimmingly. And actually, she was one of the patients who said, I don't think I'd want to do treatment without that VPro because I really felt it. And as soon as I used that vibrator, the discomfort went away and I was able to press forward. So total treatment time, 10 months, 2 weeks. Once again, always giving them a range, all right? And with 55 aligners and the VPro Plus, she did very well. Same thing. Now, this is classic. She's got it all wrong. Poor dark buccal corridors, bimaxillary constriction, poor deep bite. And so what does the dentist recommend? He recommends a veneer. And so he puts that veneer on, and she's been wearing it for 6 weeks, and she comes in, and she said, I don't feel comfortable. And I said, does that feel like a chiclet? And she goes, yeah, my tongue always goes to that. I says, well, it's got to come out. And she said, I just paid $1,500 for it. And I said, it's got to come out. I said, you've got a whole lot of other things that we have to address. This is not an attractive smile. And she said, well, the dentist, what's the dentist going to do? I said, he'll be glad to do something else for you when you're finished. Don't worry about that. So we removed the veneer, did Invisalign Comprehensive. In this case, I threw in the VPro to enhance her aligner tracking and expedite treatment. because I want to have a great result, and she got a great result. Filled in those buccal quarters. She really loved her smile. And at the end, she said, Dr. Breen, I have to get that veneer. What would you think if I had veneers all the way across? And I said, excellent idea. Let me call your dentist and see if he'll give you a discount. So I called the dentist. And I said, I took that veneer out, but she wants 4 veneers now. And he said, oh, yeah, just bring her over. I'll be glad to. So when I get these calls or these calls from orthodontists saying, aren't the dentists upset? No, because you remember that you're working as a team, and what supports your practice supports their practice too, even if they don't refer to you. So, and it just benefits the patient significantly. And I can tell you, she's just really very pleased with the final result, both cosmetically and even with her veneers. So total treatment time, 13 months and 2 weeks. Once again, 5 to 7 day exchange. When I've tried to do this without a V-Pro, it just doesn't happen. They end up in tracking, then I have to reboot because there's no recapturing it. And after 68 aligners, she was still able to come through very close to 1 year. And that's the goal. I'm trying to finish these cases in 12 to 14 months. This woman lives 68 miles from the office. She has to pass a total of 30 orthodontists just to get to the office. But she said 4 or 5 of them over a period of 5 years said she was too old. And because she had an implant on this molar and a bridge down here, they didn't want to muck with that. So they said there wasn't much they could do. But she hated this. And I said, no, of course you can do something about that. She said, really? I said, yeah, but we're going to have to expedite this because we have to change the physiology of your bones so we can close this Cumberland gap. So she said, if you can do this, she said, I'll do anything, even travel. So with this V-Pro, you get better aligner tracking so I can see her less. So in spite of the fact that she lived far away, she did exceptionally well. Wanted to, and obviously I was very keen on closing that diastema, and I think she did very, very well. I'm so pleased that she forced her son to come and make the trip. And we were able to work around the bridge without disturbing it. I would have liked to have moved this tooth, but that's the implant, so that's always irritating. I call that collateral dentistry, because it gets in the way of getting really exceptional results. And I didn't move this because I didn't want to open a contact there. So not happy with that, but I was just happy that I could really address her principal concerns. And her son's just a wonderful, wonderful patient. We were able to finish in 14 months. On this patient, it was a 6 to 7 day aligner exchange, probably because of her bone morphology. Once again, the idea is to change the physiology and individualize it. So that's where the V-Pro really comes in handy, because it's addressing that. And then with the aligners and the velocity and the ClinCheck, I'm addressing the velocity tooth. So what have I learned from incorporating high frequency vibration into the treatment of clear aligner patients of all ages in my own practice? Number one, the majority of patients admit to a reduction in discomfort. Certainly not all, but I have to say the majority do. And as I said before, I've got a number of patients that have actually unsolicited said, I don't know if I'd want to do aligner therapy without this, because this really helps. I had a physician say that, I exchange my aligners after dinner, then I go back to the hospital. She said, but I'll wear the V-Pro in the car. By the time I get there, I'm not thinking about my teeth, I'm thinking about my patients. And she was one of them, said, I don't think I'd want to do this without this vibrator. And then some patients have claimed that they would not want to, as I said, to undergo treatment without. I think I've had at least a dozen and a half of patients that have said that. In addition, in the majority of my patients with excellent aligner wear and an efficient ClinCheck, the aligner exchange rate can be expedited, 5 days instead of 7 or 7 days instead of 10. And I can tell you the reason why I've underlined an efficient ClinCheck is because high frequency vibration will also unmask an inadequate ClinCheck. And it's really taught me a lot, because when things are going well and all of a sudden the patient untracks and I go back and take a hard, clean look at it, I realize I've made a mistake in the efficiency of my ClinCheck. So it's just a matter of rebooting. I address that problem and we pick up the ball and keep going from there. So it's really actually been very helpful in focusing on some of my mistakes with ClinCheck that I've been able to rectify, so my practice gets better and easier as we go along. And in Invisalign First patients, when I use a high frequency vibration, it permits bi-weekly aligner exchange at best, and at the worst case scenario, it allows 5-day aligner exchange. And that's what truly accelerates treatment. And the acceleration is unbelievable. In my average preteen case previously with fixed appliances used to be 18 to 20 months. Now it's 6 months. It's remarkable with this high frequency vibration. So when attempts have been made to expedite aligner exchange in my own practice without using vibration, these aligners, like I mentioned before, invariably untracked within the first 5 to 7 aligners. So if there's no better control than that, all right? And my patients are never given a specific exchange rate, but rather a range based upon tracking if no high frequency vibration is used. So the only time I give them a specific, like 7 days or 5 days, is when I know that they're using the high frequency vibrator. And even then, I still tell them, don't get foolish, watch the tracking. But I've been able to get through cases on a regular 5-day schedule or a 7-day schedule. And I can't say that for my aligner patients that are not using a vibratory, high frequency vibration device. And then I found, since I do a lot of mops as well, when you package them together, there's a certain synergy that you get using them combined. All right. Now, research has indicated that high frequency vibration could enhance osteoblast proliferation, as well as the precursors involved in bone remodeling. We know that, and that was good research. We also know that research has shown that high frequency vibration appears to increase osteoblast and osteoclastic activity. Those were the lab results on animal studies. And then further evidence indicates that high frequency vibration significantly prolongs the effect of orthodontic forces on osteoclastic activity. So high frequency vibration produces greater orthodontic tooth movement beyond the mechanical benefits of enhanced aligner seating. That's definitive now. And it might be reasonable to conclude that high frequency vibration used in conjunction with MOPS may prolong the MOPS effect when applied to accelerated orthodontic tooth movement. My own personal experience is this. I found that the MOPS effect, when you're able to exchange the aligners every 3 or 4 days, will, depending on the patient, last from 3 to 4 months. After that, they're going to 5 and 7 days again. But when I've also piggybacked high frequency vibration to MOPS, I find that that 3 to 4 day exchange will extend to 4 and 5 months. And seriously, if you can do that, you're blowing through 50 aligners in 5 months, and that's been huge because I certainly can't do that with any type of acceleration. And not only that, with these patients burning out after 6 or 7 or 8 months, this has really become a critical aspect and application to my practice, and I can't say enough about it. So, and I get these patients. This patient lives 6 months here and 6 months in France. Believe it or not, she's got her own specialty perfume line in Paris. And you can tell because she smokes those Guiton cigarettes that a lot of the French do, and that's where that stain comes from, okay? But she told me, she says, I need a nice smile, but I can't wear any rubber bands. And yet she's got a crossbite. She's got severely constricted bimaxillary arches there. She has no function whatsoever. She's edge to edge. And so, she's got no smile aesthetics. So I said, all right, then we're going to piggyback this. And she said, all right, anything that you can do to just make this as easy as possible. So the game plan was, again, Invisalign Comprehensive, develop and coordinate the arches, finish with an aesthetic smile arc, and do MOPS and V-Pro. And again, not doing any elastics whatsoever. So I know this is an Invisalign webinar, it's acceleration, but I just want to show you why it takes so many aligners. So in order to get these smile arcs, you have to use the Nicosia extrusion protocol. That means you have to bring these teeth out and then bring them down and back so you can get this relative extrusion. And also I need that for the slow but methodical arch development. This is not expansion, this is just developing the arches because all these teeth are significantly imploded. And I'm also trying to get her out of crossbite as best as I can by mandibular arch constriction and some maxillary arch posterior uprighting. And there she is finished. She's got the aesthetic result that she wants. I'm very happy with it. Got the arch form that I wanted. Still a little edge to edge, but I'll accept that. And more importantly, finished her in 14 months and 1 week. And that was 6 months here and 6 months in Paris. Yeah. So with 77 aligners, this synergy that you get with the MOPS and the V-Pro is is perfect. Same thing here. Patient comes in and she tells me she's going back to live and work in Poland with her job, and she'd like to do something. She already had some orthodontic treatment when she was young, but they didn't address what the real problem was. They decided for a canine substitution, so I'm not going to change that, especially with 11 months. But she's got this really ungodly canine that we have to reshape to make it look more feasible in terms of being a lateral incisor. And then she's got this peg shape that, so what we've got to do is we've got the first round of Invisalign has got to stage this. Then we've got to take everything off, whiten her teeth, build this up for her, and then finish her with another round of Invisalign. And we've got to do this in 11 months. So I'm just going to show you the first round of Invisalign to show you how we stage all of this. And by the way, all through aligner treatment, she's getting this tooth constantly recontoured. So you can see all this is staged. I'm bringing this back. I use some expansion. Now we've got her nicely staged, and I didn't even go all the way. You know, I stopped as soon as this tooth was ready for recontouring with composite. And there she is finished. You can see the composite buildup there. You can see we got this a little bit more contoured, so we give her a much more pleasing smile. Again, we got better arch form for her. And more importantly, we got her in time for Poland. So even at this point, she ended up wanting to reschedule for getting a more whitening there. So we actually whitened her twice. Very happy, 64 aligners, 9 months and 3. I could never have done this. In the olden days, this was 18, 20 months, sometimes even longer. So going from this smile to this smile, significant difference, dramatic. She even asked for her pre because she wanted to show her family in Poland. So let's talk a little bit about high frequency vibration in periodontically compromised patients. So I can tell you, there's plenty of research out there, but in the absence of orthodontic tooth movement, high frequency vibration has been found to significantly and rapidly improve alveolar bone density due to its gradient effect. What that simply means is that you don't have to have contact with the bone, that just simply placing that vibratory device, the high frequency mouthpiece on the teeth, by virtue of the gradient effect, it has an impact. That vibration gets translated to the bone, and that's what creates this great improved bone density. And we have to take advantage of that, and that the research continually supports this. So on the basis of that research, I was willing to take a chance. So this poor guy's been followed by a dentist for the past 20 years, and they've been watching this. The periodontist has been watching this, and I'm not sure what they're watching, but they're watching all the bone go away. So, and he came in and actually is the manager of the shopping plaza in which my practice is located. And he said, Dr. Brigham, if there's anything you can do, I want to keep my teeth. And they're telling me that I'm eventually going to lose those lower teeth and possibly some on the upper. So I'm willing to take a crack at this just based on my experience with high frequency vibration. And I know this guy's going to listen to me. So you can see, this doesn't look good, all right? And this does look very close to being 4 on the floor. This looks like furcal involvement to me. So eventually, I think he's probably going to lose some teeth. But the bottom line is, doesn't mean we have to set the date. So the plan is get some comprehensive periodontal clearance, got some Invisalign, full Invisalign. We're going to get him a much better aesthetic smile arc, improve the arch form, but we're going to do this with the V-Pro to enhance the tracking, X-bite treatment, and continue through retention to hopefully augment some bone density here. Here he is finished. He's got much better smile, real happy with that. Once again, you can see his teeth haven't fallen out. Already he ran out. He's still using his vibrator, so we got the implant in, and he's using the vibrator to really get good bone density around that. And he was finished in 12 months on a 5 to 7 day exchange rate, had 2 refinements for 90 aligners, and using that V-Pro 5 twice a day. Now, why do I use it 10 minutes a day instead of 5? If you read Alakani's research, he found that if he used it 5 minutes a day, that's all that was necessary to accelerate treatment. But if he used it 10 minutes a day, he found there was additional accelerated tooth movement, but it wasn't statistically significant. But if I can get a little bit more bang for the buck, I don't care if it's statistically significant. I'm going to take advantage of that additional orthodontic tooth movement and the acceleration. So once again, he's continued his vibration to support the implant, as well as having used it at 10 minutes a day throughout the entire active phase of treatment. But now there he is with his crown, and he's continuing to use his high frequency vibration even after his soft tissue grafting, and he had a little bone placed in there. So not bad to go from here to there, and he's not spitting out any teeth. And he went from a plus 1.5 mobility here. Of course, he's stabilized here, but these are rock solid right now, and I don't think those teeth aren't going anywhere. And if I use my imagination, I think he's got some improvement here. And the bone chips that we use to support this is going very well. I expect to see even better mineralization down the road, and I think this has improved a bit. And I think there's been some significant improvement, at least from my vantage point. And I think he's got some pretty good film. So I don't think these teeth are going away. And he's very encouraged, and believe me, he said, I'll just continue using this. And I've encouraged him to continue to use that. So there he is pre-treatment with all his gingival recession here, and here he is finished. So I am not unhappy with these results with the high frequency vibration. In fact, I'm rather grateful for that. And I really do hope that we can hold on to these posterior teeth for much longer than the periodontist originally anticipated. Even the periodontist is pleasantly surprised. And once again, now I'm starting to get a lot of these, okay? And once again, patients have been, no one wants to touch these patients because they're afraid of the consequences. They're afraid teeth are going to fall out. But now we've got something that we can combat that. It's unfortunate that the patient presented with an implant there, because now I'm going to have a problem. I can't move these teeth, all right? So I'm going to have to just work around that. But he's got plenty of fish to fry here. We want to get rid of this, give him a much better smile, and do something about this little fang that's sticking out here as these tissue continues to strip and bone loss continues to occur. I'm not finished with this patient, but he does have some significant vertical bone loss, especially around the interior teeth. So the game plan against is to get periodontal clearance using Invisalign Comprehensive, apply the V-Pro to not only enhance aligner tracking and expedite treatment, but to continue through retention to augment the bone density. Now I'm only on aligner 61 of 84. I find on these patients, I don't get the intrusion that I want, so I'm not concerned about the posterior bite. It just means that I've got to reboot him. And I'm still waiting for the rest of the aligners, because he's still tracking very well. Got this out of the way. He's motivated because he sees the change, and so does his wife. And now in my next round, I'll change this to a vertical attachment so I can get this root kicked back, get a little bit more improvement here, do a little bit more IPR to improve the canine relationship, improve the overjet overbite. So I'm really, really very happy with this so far. And when you take a look at the bone, I'm not unhappy with the bone level with this at all. Now, I don't know how much longer this is going to last, but I see additional bone there, and I'm very pleased with the bone augmentation around the implant, and I'm not unhappy with any of this bone level, even with this over there. So I think that if once we finish, we continue with the V-Pro, I think we're going to even be more pleasantly surprised than we have, simply based on my own clinical experience and what the research tells me. And then I find that I've been pleasantly surprised enough to actually have to change the treatment plan. So I took a crack at this. The patient wasn't unhappy with this, but the more important is he had previous trauma, so he had some mandibular reconstruction. That's why he lost a tooth. So this is a cantilever off of this, but because of the accident, he was going to lose this tooth right here. You can see that tooth is dead and gone. Sorry about the quality of the panel, and that bone loss here. So the periodontist said, what we really want to do is take out this tooth, and after you're finished, we'll take out the lateral, and then we'll go ahead and we'll take off this crown with the cantilever, and we'll do a bridge from bicuspid to bicuspid, and that'll give them some stability. And so I said, okay. So, but the game plan, again, comprehensive periodontal clearance, then Invisalign Comprehensive, wanted to give more aesthetics there, finish with aesthetic smile arc, use the V-Pro Plus to enhance aligner tracking, expedite treatment, possibly improve the alveolar status of the lower left tooth, and continue through retention to augment bone density. And here he is prior to refinement. And just with the results, you can see I've got some bootstrap alaxis to give him that smile arc that I want. But we had to stop. I've reevaluated the bone and was pleasantly surprised. Look at that bone. Look at that bone level. The periodontist said, you know, I think we should really change our treatment plan. I think we're going to keep this lateral incisor. And I think instead of a bridge and cutting out all these healthy teeth, we're going to put a crown in there and just cantilever this. So he'll have 2 cantilevers there. And I think that'll work. And that's exactly what we did. So he's got 2 crowns, 2 cantilevers. We've got our aesthetic smile arc. And this isn't a bad result. I'm not unhappy with this at all. And then high frequency vibration and alveolar bone regeneration doesn't get any better than this. So what we've found through the research is a consequence of tooth extraction is alveolar ridge resorption. And in some, in one paper, it claims that the losses is up to 40% of that alveolar ridges, and it's progressive atrophy of the bone, and it occurs within the first few months post-extraction. And that high frequency vibration has been shown to preserve that alveolar bone following extraction. So although I rarely take out bicuspids, now if I'm taking out any bicuspids and the patient doesn't purchase one, I'm just going to throw it in because I want to preserve that, because I'm very tired of having these fixed appliance therapy where you close the extraction site and they're still a little bit opens because of atrophy of the bone and the bony ridge. So I'm looking forward to really having a significant improvement just using the V-Pro on those particular cases, although I haven't taken out a bicuspid in at least a couple of years. And I found that high frequency vibration has been shown to maintain alveolar height following extractions for implants and to improve bone density immediately following implant placement. So both of these observed phenomena are believed to be due to vibrations, once again, gradient effects. So it doesn't have to touch the implant. All you have to do is apply it to the tooth, and by virtue of the gradient effect of high frequency vibration, that vibration goes through the tooth to the bone and impacts the adjacent bone. So conclusions, and I know that Kravitz has been, he's been all over Invisalign for many years. I think this is his 3rd publication investigating the accuracy of Invisalign. And his most recent conclusion, which is I think this was back in 2018, was that overall mean accuracy of Invisalign is only 50%, but it's improved from the 46% that he found back in 2006. And he found that the best accuracy is lower incisor tipping at 70%, and overall improvement since 2006 and 2009. And he attributes that to Smart Force and Smart Track features. But with this study, he was actually exchanging these liners every 10 days, which is not unusual for adults without any type of acceleration. But the problem with drawing conclusions from these AJO studies that Kravitz has been, is that ClinCheck, because he compares the accuracy based on comparing ClinChecks. And the problem is that ClinCheck is not an accurate depiction of the clinical outcome. It's rather a graphic depiction of the forces being applied to the teeth. And that's the problem. Then on top of that, you really have to rely on patient compliance and patient self-reporting to draw any rational conclusions. So there's a lot of keys that are sort of undermine the drawing conclusions from any of this research. But nevertheless, Al-Ansari has demonstrated 90% accuracy of lower incisor movement with Invisalign. That's with 7-day aligner exchange. Remember, it was 10-day and 70% without that, based on what Kravitz found. But this is 90% using the same lower incisor teeth on a 7-day aligner exchange when it's used daily. And don't forget, this research is being used on only 5 minutes a day. I'm 10 minutes a day. All right. And so the conclusion that he drew is augmenting the bone physiology with the vibration enhances not only tooth movement, aside from the benefit of enhanced aligner tracking. So now it's not just about aligner tracking, which I've been speaking about for years, but now there's cogent and very specific and conclusive research to show that you are getting some acceleration of the tooth movement, as long as you stick with high frequency vibration. So just a summary of how to apply high frequency vibration in clinical practice. As far as active treatment, an aligner tracking device to offset inadequate patient compliance. So you can actually pick up on this, because my patients definitely aren't. I'm lucky if they wear them 16 hours a day. So this is adjunctive therapy in my mind to help enhance their tracking and keep treatment moving along. And just by virtue of that, I've been able to reduce the amount of refinements that I still have times on my complicated cases where I have to do 2 refinements, but now my average is just 1 refinement. I'm very pleased with that. And it's also an aid to promulgate tracking for challenging tooth movements. I find that to accelerate treatment in highly compliant patients with efficient clean checks. And more importantly, this is my protocol, 5 minutes a day, twice a day. And also in active treatment as an adjunctive treatment to reduce discomfort associated with orthodontic tooth movement, because I do have patients expressing concern about it even now. And for retention, as a facilitator of bone remineralization following active tooth movement, now I'm saying 3 months. I'm lucky if I can get them to 3 months. They usually burn out after 2.5 months. But nevertheless, that's why I encourage them to use it 5 minutes a day, twice a day, just to enhance that bone resorption and to enhance the retention program. All right. And as far as extraction and implant cases, as adjunctive therapy to preserve the alveolar bone following extraction and to facilitate orthodontic tooth movement in extraction sites. Okay. And also as adjunctive therapy to support bone mineralization following implant placement. All right, very important, because I'm hoping that the dentist can start placing the crowns sooner than 3 or 4 months that they normally do right now. So just to wrap this up, recent research has clearly determined that only high frequency vibration can trigger catabolic cascades that impact orthodontic tooth movement in the presence of mechanical forces. And that since 2018, research has determined that high frequency vibration has increased catabolic cytokines and reduces bone mineralization at the periodontal ligament. And clinical experience has demonstrated that high frequency vibration may in fact prolong the effect of MOPS. And in the absence of orthodontic tooth movement, high frequency vibration is highly anabolic, far more anabolic than low frequency, and can be applied to retention, extraction sites, and to implants. So once again, a little plug. Dr. Glazer and I are ready to launch in August our clear aligner therapy course. And I've included the syllabus so you can see all of it. And once again, I'll be reiterating the MOPS and high frequency vibration as part of my acceleration lectures. And thank you. This has always been a pleasure, and I don't take it for granted. And I really appreciate the opportunity to speak on my clinical experience. And I'll be happy to field any questions that you might have. Do I charge extra for the V Pro in my practice? Yes, I do. And what I do is I charge $5.95 to $6.95, depending on how much I'm going to be using this. Even for my Invisalign First patients, that gets tacked right on there. But yeah, I don't. Now, there are occasions where patients just can't afford it, or they're hemming and hawing about it, and I know that if without it, I'm going to have some problems with bone, so I will throw it in, but I rarely do that. And since I use a lot of combination platters, so to speak, with the MOPS, my fees are usually anywhere from $800 to $1,200. And if I throw in a V-Pro, then I give them a package deal of $14.95. So thank you for that question. It was a good question, because I don't think you should be giving it away. I think you should charge for it. You know what the key is? You really have to convey to the patients the benefits of it and to get rid of those myths, because you still have orthodontists that are rendering opinions based on no information or not understanding the literature. They're saying, oh no, that's just that doesn't work at all. That's just something that is flawed. And especially if they're following Kevin O'Brien, it's just wrong. So go ahead, dive into it. And John, always glad to have you. And I'm glad to see that you're starting to understand how these adjuncts worked. And that's the whole purpose of these webinars, to just impart to me my, to you, my clinical experience, and to convey that I don't have my finger on the pulse beat of other people's practice. All I can do is give you my clinical experience. And the only reason I lecture for Propel is because not once have they, even when they were trying to push acceleration, I wasn't convinced that the research was there. And it wasn't until 2018, and I just didn't rely on one research paper. Research continues to come in, and they keep feeding it, and I continue to read it, and I'm very comfortable now to say that there's enough body of literature to show that high frequency, and only high frequency, when applied properly, accelerates orthodontic tooth movement. Can we access this presentation again? Yes, first of all, I hope you'll consider signing up for this online, on-demand, those are going to be 24 webinars. I plan on adding some additional material to my MOPS and to my acceleration lecture. So I hope you'll, you'll consider that. If not, just talk to Propel, because I'm sure they'll give you access to this webinar. But once again, not trying to plug my own thing, but Dr. Glazer and I have, that's why it's called an advanced course, but you don't have to be advanced, but we want to take all of your clear aligner practice to a whole different level. And I think you'll be pleasantly surprised. Take a look at the syllabus. It's pretty extensive, and it's something that we're presenting that I don't think you can get anywhere else in the world. So thank you. I really appreciate it. Thanks for all of your kind comments. I don't take that for granted. Okay, I don't see anything else coming in. So again, thank you. I think most of you have left already, but again, I appreciate it. John, it's always a pleasure. And I hope to cross paths with you in the future. So be well, enjoy your practice, and consider adding acceleration to it. Be well.